So Dr. Grant, as you know, the pandemic has had major effects on healthcare delivery, particularly has added the rapid institution of telehealth. So what do you think will become the patient care standards looking forward as a result of this pandemic, and perhaps looking forward as technology becomes more engaged into healthcare?
That's really a good question. And thank you, Dr. Lutz. Thank you. And thank you everyone at the MIU Health Foundation for having me. This is really a great experience, and I applaud you for the work that you're doing. Telehealth, it's interesting. You know, telehealth this is not a new finding. Telehealth has been around for a while, but it really took COVID to really take telehealth to a new level, especially when people felt uncomfortable going into the physician's office. They felt uncomfortable going for care. I will tell you, certain places it's exploded more than others. Behavioral health. There's no doubt 85% of our visits that we get claims for in behavioral health are done by telemedicine. And we're not seeing those numbers dropping at all. Now, what we have seen is some of the visits during the height of COVID, when people were really reluctant to go into an office. We see them coming down a little bit. They peaked March, April, a little bit of May. Now we're seeing them come down. I think telehealth is here to stay. The question is really two-sided. One of which is you're going to see more and more telehealth for things where you really don't have to touch a patient. And it's just more convenient, and it's easier to access care, and it's easier for your physician, and it's easier for you. And you're more likely to see a physician if you don't have to go in, and you don't have to, to fill out all the papers. If you don't have to go in and wait in the waiting room, then wait on the crunchy exam room paper. That's something we know is with us today. We're also seeing a lot of, and I think this is a good thing, a lot of things that used to be handled with a phone call just a year ago are now really being handled by telemedicine. And it gives the physician and the patient a chance to look at each other, to interact, not just a phone call. Hey, Dr. Lutz, your hemoglobin's all fine, click. It gives the physician really an opportunity to see the patient, talk to the patient. And there's the last part about telehealth, which is really cool, is in a lot of cases, when you go out far distances for care, you may not have to go those far distances anymore. So there's a lot of groups that are doing some really great work with long distance care. And then we didn't have that a year ago because people are more familiar with it. My specialty, I'm an anesthesiologist. We're seeing more and more tele-ICU, where we have actually banks of physicians actually housing. And these are specialists. These are ICU subspecialists that are able to actually go into the rural areas and actually see what's going on with patients, and actually call into the rooms, talk with the nurse, figure out a plan. We didn't have this technology 5 years ago. So we've got all these things at our fingertips. Follow-up appointments after surgery. If you're just saying, trying to see how are you doing, what's going on with your catheter, what's going on, that may be a telehealth visit now, because you really don't need to touch the patient. So I think now that we're opening up to it, we're going to see how much of the world really is going to just embrace telehealth and telemedicine.
Well, I know my patients love telehealth because that's the way they avoid the digital rectal exam. Because we've yet to find a way to do that through the screen. We're trying, but we haven't figured that one out yet.